Good evening. Welcome to my yet another interesting video on the nicotine or smoking induced sperm damages and how to reverse those damage in cases of reduced sperm motility, reduced sperm count and reduced sperm morphology. So welcome to this video. Watch it till the end till you get the complete information on how to reverse these damages according to the holistic approach. So what you need to understand, dear friends, is nicotine induces something called free radical damage or increased reactive oxygen species, which means, in simple terms, the smoking, whenever a person smokes, it releases lot of chemicals, around 4,000 chemical compounds into his body, and there may be vasoconstriction, in the sense the blood flow to your scrotal tissue or the testicular tissue may be reduced. That may be one reason of sperms not being produced in a good shape and good numbers. It may lead to something called free radical damage, that leads to something called increase in the damages of the internal channels of the seminal tubules which are inside the testis, and thirdly it may produce inflammation, and inflammatory response lead to something called cytokines, and that leads to improper sperm production. So what you need to understand is nicotine is playing a havoc on your reproductive system, and if you have a father to be and if you're wishing to have a baby soon, then you really have to quit smoking in a gradual way with the help of some support in a way that you can take help of some support groups, apps, and nicotine patches, nasal sprays, to name a few, right? But now let me come to a very important aspect of how to reverse those damages which has already happened to you. Yes, holistic approach has got a very good solution for that, what we call as detoxification process. I'm a doctor of Ayurveda, so I advocate this to my patients. How this acts is, uh, in our body, everything, according to Ayurveda, we call everything in a body is made of something called srotas, or the channels. These are the micro tubular structures laid all over the body, and everything in the body depends on how these channels work. So, right, srotas not only plays a vital role in the manifestation of a disease, but also it is very, very important to maintain the best physiological function of the human body. Srotas, what we call in Ayurveda, are an important part of a human body. They work as communicating channels, especially for the nutrients, which are to be utilized of permanent, something called dhatus. That is, like, what you need to understand is, in our body we have segregated, according to this holistic science, we have segregated our body into various kinds of um, doshas, what we call dhatus, and things like that. Okay, so what is the importance here is, the impairment of the function of these srotas, or the microchannels, lead to something called the blockages, or srota avarodha, or obstruction. So there are many dysfunctions which may happen, but in context to the study here, it is said that srotas are the empty passages which from the root of the, they're present all over the body, but then the roots are present in some particular part of the body, and that particular part has to be taken care by. For example, if it is the male reproductive system, it is called shukra vahadot srotas, what we call. So here there is something called, why these srotas may be blocked, what must be the reason of this. It is a very deep science, not to bother much. But now what here in this context is, when a person is nicotine dependent for a couple of years, what happens is these srotas are somehow blocked, and there is no proper formation of that particular semen, what we call shukra in our Ayurveda. So that leads to improper formation or improper secretion of those seminal fluids and all that, right? So how to cleanse it? What we need to understand is, this is an organ testes are two organs in the suspended in the scrotal tissue, and the circulation to these organs have to be optimal for the right production of the semen, right? But when these testes are either blocked by the uh, this damage is done by the nicotine, either the blood flow is blocked, or even when there may be production of the sperms but they are not able to reach your penis during the intercourse, and then it's not ejaculated. Many reasons may be there for this obstruction. Okay, primarily what happens is the seminal vesicles which are present inside the testicular tissue. What you need to understand is seminal vesicles are the basic cells which contain something called Sertoli cells, which are important for the sperm production. When these seminal vesicles are damaged with the nicotine, impact of nicotine, the germ cells what are present in the seminal vesicles, these are the sperm producing cells, they tend to get damaged. So when we advocate this detoxification therapy, we need to clear all those blockages which are present inside the channels which are responsible for the semen production, right? So here by detoxification, we take the patient through a proper process of nourishing his body first and then taking through the process of cleansing the body gradually. So the nourishment can be done with, there's a proper therapy, like first of all we take the patient through something called internal oleation or snehapan. Then there is preparation of the body. Then the toxins are eliminated through his either his upper channel or the lower channel of the body, that is vaman or virechan, in the sense either vomiting is induced or purgation is induced. It is all very scientific and it is carried out with the in the presence of a doctor who has adequate experience on it. So detoxification would be the first step towards the cleansing or uh, releasing all these toxins. And then once the body is cleansed of on, and once the detoxification occurs, and then when you start giving the person with adequate number of herbs or organic supplements, then the absorption is better, and then the tissue which is degenerated or which has been blocked, I mean the srotases are cleared, the circulation is cleared, and then the tissue, the testicular tissue starts producing the sperms slowly by slowly, because the channels inside the seminal vesicles are cleared at the microcellular level, and then gradually the sperm start being produced in these seminal vesicles. And some even we have seen results with patients with azoospermia as well, in the sense with zero sperm count. So if you are a smoker and a father to be, and you are willing to have a child soon, go through these processes one at a time, so that those damages which have happened to your testicular tissue at some point of life without your knowledge, first step I would advocate is stop smoking. Secondly, you can go through this detoxification process, and the last would be usage of good quality herbs and organic supplements. So thanks for watching this video. For the people who watch me live and for people who watch me later, please comment in the comment box what value it has added to your knowledge base. If you are a couple, or if you're a male who is trying to have a baby with challenges in your sperm count or motility or morphology, you can take my help by booking a call with me on my consultation, and there is a link provided in the comment box. Have a nice evening.